We're back with the Quantum Yoga podcast, and today I'm really excited to have you on here, Dr. Tim. We got Dr. Tim Jackson, who I've known for a few years now and have done some personal consults with. And you were part of, as far as I know, correct me if I'm wrong, you were part of the sort of functional medicine movement, almost before it even had a name. And people were talking about it and it was popular. You just have so much holistic knowledge around how the body works, which I really appreciate. And I know a lot of listeners do. You're interviewed by everyone in the podcast sphere who knows anything. You've written a ton of information on this on your website, which by the way is healyourbody.com.
Healyourbody.org.
.org. Okay. Healyourbody.org. And the topic is mast cells for today. So welcome to the program.
Thank you for having me. I appreciate it. I love the name of your podcast, because typically people kind of generalize yoga into kind of this crop circle type thing, and you're adding kind of a quantum physics perspective to it. So the best of art and science always wins out in my book. And you were always, since I've known you, easy to work with because you had such a appetite for knowledge. And so I didn't have to beg you to, experiment with things. You were already, 10 steps ahead of me. So I appreciate that.
Well, great. So introduce us to mast cells and why this is important on a sort of very overview type level.
Yeah. So, before we went on the air, you and I were saying that if we listed out every disease, syndrome, illness, or imbalance that we know of, and we look for common denominators, mitochondrial dysfunction would be there. And then mast cells are, they've been a topic for a long time, but we're learning more and more about them, specifically in various ailments that previously we would have never considered. And, if I just said to the average, even functional medicine person, mast cells, that's not sexy like growth hormone or gut health. But, we have mast cells throughout our entire body, and they play a role. Most people think that the main thing they do is release histamine. And while they do release histamine, the main compounds they release are cytokines, which are inflammatory. You can have pro-inflammatory, which in this case, they are like interleukin-6, TNF-alpha. And those are, if you had the nicest, smartest person sitting next to me and I injected them with those cytokines, they wouldn't be so nice or so smart anymore. And so, it has implications for brain health and nervous system health, behavior, learning, and it has a strong regulation on the circadian cycle. And so one thing that I wanted to mention, and we can kind of go from there, is that a lot of people have heard of the microglial cells in the brain, which are, white blood cells in the brain. But the mast cells in the brain actually become activated before the microglial cells. So instead of just working on the microglial cells, let's prevent the mast cells from becoming activated. And mast cells, will release histamine, which is extremely important for learning and memory. So you don't want to, have too low of histamine, because people who take, Benadryl like candy, they end up a lot of times having dementia or mild cognitive impairment from reducing histamine too much. But when you have too high of a histamine level, you won't be able to sleep, even with sleep medication, oftentimes.
Got it. Okay. Wow. So mast cells are, this may be obvious for a lot of people, but we're talking about the immune system, and the immune system that's everywhere in the body. And one of the things that, I'm just gonna like high five you again, is that every time we do talk, it's almost as if you're keep walking upstream
Mm-hmm.
of the chronic disease path,
Right.
and you're like overturning another rock that's now, that you just crossed into a smaller tributary, and it's just revealing a lot more systemically about how things work. So,
Yeah.
and is this? Give us some more context around why you ended up here, and how you're working with your clients around this.
Yeah, so with mast cells, a few years ago, I was speaking with an immunologist friend of mine, and we were talking about, the different chemicals that are released when mast cells degranulate or break open. And she told me, you need to look at prostaglandin D2, which is an inflammatory compound, and it can cause hair loss, and just overall inflammation. And that's the most prolific compound, along with the cytokines that are released from mast cells. And so I got into it because I started getting a lot of people, more and more people, who they could only eat 5 or 6 foods, and they would say they react to everything in the air, or they would remediate mold and we would detox their body from mold. But no matter where they went and how clean it was, just the smallest amount of mold or whatever chemical would trigger a reaction. And I didn't think the answer was to move every 2 months or 3 months. That's just not sustainable. And so when you become you have T helper 1 cells and T helper 2 cells, and when you become depleted of glutathione, your body gets stuck in this Th2 dominant state. And that's where you get the 3 A's: allergies, asthma, and autoimmune issues. And so those people, interested me because I also have a strong background in epigenetics. And, we look at DAO, diamine oxidase, which is the enzyme that breaks down histamine in the gut. And then we look at HNMT, histamine N-methyltransferase, which breaks down histamine into N-methylhistamine. And then that compound goes through the MAO enzyme. Mm. And so if you have glitches in those pathways, that can certainly make your histamine bucket, more full. And one thing to note is that a lot of people who have, let's say, they're homozygous 2 copies of DAO, if they start supplementing with that DAO enzyme prior to meals, they can tolerate more foods, but they also lose weight. And so, you're seeing the effect of inflammation in the gut. And then, systemically, symptoms can range from, severe insomnia to brain fog, anxiety is a major one, and various other illnesses that get triggered by mast cells. And you can actually have a heart attack due to mast cell activation. And the reason being is that the cytokines that are released, like interleukin-6, they damage the lining of the blood vessels. And so if that happens, in the coronary arteries, you can have spasm and eventually a heart attack. Now, I don't know any cardiologists that are looking at mast cells, as a possible contributor to a heart attack. But histamine definitely has a reaction on, our blood vessels and cardiovascular system. When we look at, the cardiovascular system as a whole, we've known for a while that things like interleukin-6 will drive up C-reactive protein. And this is kind of a scary story, but I had a patient recently, and she said, I'm going to see my cardiologist in a couple of days. I said, well, have him run your high sensitivity C-reactive protein. And she asked him, and he said, what's that? Which is pretty scary because, that's the most, or the strongest predictor of a future negative cardiovascular event. But with the mast cells, they affect the endothelial lining through multiple mechanisms. If you have fluid retention, you can assume that there's a mast cell component, because what it does, you basically get blood vessels dilated, or, stuff pooling in that area.
Mm-hmm.
And this brings up kind of a little bit of a tangent point, but an important one. And that is that estrogen, so if you're estrogen dominant, male or female, that stimulates mast cells. And mast cell activation, whether it's from, a food sensitivity or an environmental reaction, increases estrogen. And so you have this, negative synergistic interaction going back and forth. And so sometimes if you address someone's estrogen dominance, they may need less support for mast cell activation, and vice versa. So, that's something to take into account. And of course, we know, hormones have a humongous effect on the heart and cardiovascular system. And so that plays into the mast cell role as well. Histamine, I mentioned before, yes, it's released from mast cells. It's actually degraded within about a minute. And so the most accurate, and we can delve into this further, but the most accurate marker for histamine is something called MIAA, which is just a metabolite of histamine. And some labs test for it, some don't. But you can't assume that because histamine is not high, that you don't have a mast cell issue, especially when histamine's not even the highest concentrated chemical in a mast cell. And so.
Yeah, well, it just sounds like it's so pervasive and ubiquitous, mast cells, that it's really hard to see what it's going to trigger, what sort of, I mean, tell me if I'm incorrect here, but it just sounds like, well, you don't know if it's going to cause a histamine-like problem, or it's going to cause a problem with estrogen, or is that both going to happen, or one of them's going to happen and the other's not, or one of the other multitude of things that can occur. If we can go back to the estrogen thread. So if someone just does a blood test for estradiol, so I'm assuming you're talking about E2 when you're talking about estrogen.
Yeah, so it stimulates luteinizing hormone, which goes on to produce estrogen. So it's probably has an impact on, all three, E1, E2, and E3. But, estradiol is the most potent estrogen. So that one is typically the one you want to reduce.
And your liver's basically taking care of that, right? It's the organ that is handling the sort of estrogen load in your body, right? And so if if that is high, then there's also something going on with your liver that's preventing it from keeping up with that. An interesting connection here, because I have had this, and I think you in your history have had this, is a lot of mold exposure. And so isn't that the same detox pathway that that the liver uses to detox mycotoxins is the same as E2? Is that correct?
Yes. So compounds going through the liver have to go through phase 1 and phase 2, and then phase 3 in the gut. So you can have a liver issue, whether there's phase 1 cytochrome P450 enzyme issues, phase 2, which involves methylation, acetylation, 5 or 6 different reactions. So your liver, not only is it filtering normal metabolic byproducts, which is a full-time job in and of itself. Now we're bombarded with over 100,000 environmental chemicals that we bioaccumulate, and then the new exposures we have. And then if you have dysbiosis, that will drive up an enzyme called beta-glucuronidase, which will cause you to reabsorb your estrogens from the bile.
This enterohepatic loop, I'm so glad you're bringing this up, because this was an issue that I had, a lot of reabsorption. And not only with that, but there are a couple of other, so mycotoxins could be a part of that, that reabsorption and this sort of negative feedback loop that occurs. So this part right here would be the phase 3 of detoxification. Is that correct? By the time it moves, it's in the bile now, it's going down into the feces. And if it's reabsorbed through the, at the point of the, I think it's around the ileum, right? Where that reabsorption occurs, then if you've got LPS, you've got beta-glucuronidase going on there, then you're going to have the retoxing effect essentially, instead of it going out of your feces.
And it's funny that you mentioned mold, because that is the #1 trigger of mast cells. Number 2 is viruses. But anything, ultimately, you know, what happens is you see someone starting out maybe reacting to, you know, 4 or 5 things, whether it's environmental or foods or whatever. And then that continues to grow and grow and grow. And you get in this vicious cycle where, okay, you have mold and you have viruses and you have to address them, but the tools we need to use to address them will also further stimulate mast cell reactions. So we have to put a Band-Aid on for a while and give you enough mast cell stabilizers. And that can be, supplements such as quercetin, luteolin, which crosses the blood-brain barrier, and also histamine blockers. So, things like Zyrtec, Allegra, et cetera. There's 4 histamine receptors types in the body, and different medications and supplements will target different ones. But, in order to address someone's viral load or their mycotoxin load, they need to be able to tolerate the supplements and the ingredients. And if they're reacting to everything, then, we're just going to keep spinning our wheels. So, I tell them this is not, hopefully it's not a long-term thing. I mean, maybe you need one supplement or something long-term to support mast cell issues, especially if there's epigenetics involved. But once we can reduce the number of stimulants to mast cells or stimulators of mast cells, then, they're much less likely to be reactive. And so getting that viral load down and mycotoxin load down is important.
So if you were going to, so that would be kind of step 1, and maybe even concurrently or just after that would be to manage dysbiosis and increase phase 3 portion of the detox. It wouldn't make sense to upregulate phase 1 or 2 if phase 3 is not working properly. You're just going to cause more problems. So it's almost a backwards, a reverse engineering of the detox pathway. Okay. So if I can ask you, I don't know if this is going to take an hour in itself, but what is your go-to way for handling dysbiosis?
Yeah. So, I have a number of natural compounds that we can, use, like oil of oregano, compounds or supplements like biocidin, different enzymes to break up biofilm in the gut. But, what I found is that, diversity is the name of the game. And even, for example, with quercetin, which we might use as a mast cell stabilizer, you don't want to go over a gram a day or 1,000 milligrams a day, because long-term it will decrease the diversity of the microbiome. And once those species are gone, they're gone. Now, you can marginalize them, let's say you took an antibiotic or whatever, as long as there's still, a small percentage of the population left, then we can work to, increase the size of that population and the diversity over time. But to give you another quick example, berberine, something that a lot of people take for blood sugar balance, et cetera. If you use that too long, that will also destroy the microbiome and the commensal bacteria. And so It depends, for example, on what type of dysbiosis someone has, what species. I'm looking into now, and they're becoming more popular. They're very popular in Europe, but bacteriophages, which are viruses that infect bacteria. And what's so unique about them is, let's say you have a dysbiosis and I drop a capsule of oil of oregano in there. It's like dropping a bomb. Whereas a bacteriophage is like a sniper. It's not going to go over here, up here. It's going to go, and it's only going to target, that bacteria. Now, it can only address, at least to my knowledge thus far, bacteria. So there aren't any bacteriophages for parasites or yeast, at least not yet. But there are not very many available in the U.S. Our good old, FDA keeps them on the down low. But that is an area that I'm very interested in, because you want to do as little collateral damage as possible, right? And so we break open the biofilm, but the neat thing with bacteriophages is they can penetrate biofilm by themselves. And so you kind of you're getting so many benefits from one nutrient or ingredient, that the main thing I try to do is, keep them on an antimicrobial for as short of a period of time as possible. And that involves upregulating or boosting what's called secretory IgA. So our immunoglobulins, we have 5 different kinds in our body. IgA it's in our oral cavity, our nasal nasal cavity, the lining of our lungs, the urinary tract, and the gut. And if it's low, we can go in, let's say you have 3 pathogens. We can go in and kill them, but if that secretory IgA remains low, then another pathogen or the same pathogen is going to come back. And so that's why, a lot of people will say we need to fix the terrain. A lot of people don't really know what that means, but part of that is making sure the IgA level is optimal. IgA levels can be impacted by DHEA to cortisol ratio. So, if there's HPA dysfunction, then that can drive gut dysfunction. And then, it puts you in fight or flight. So peristalsis slows down, chance of SIBO goes up, and, you can just get a cascade of events there.
So what's your, I don't know if you can even say your number one for increasing secretory IgA?
So it's a product that I have no financial connection to, but it's called MegaIgA. It has immunoglobulins in it that are dairy-free. It's from Microbiome Labs. And so the other way, or one other way that IgA may be low, is that you have what's called CVID, or common variable immune deficiency. A lot of people have it and don't know it, but we would test your serum levels of the 2 IgA subclasses and your IgG subclasses. And those people, sometimes the supplement will be enough to, if you use it in high enough doses, to bring up their levels. Other times they have to do IVIG, which, back in the day was a 7 or 8 hour IV, and there were lots of potential side effects, including stroke. And, you had to put it in your vein and sit there for 8 hours. Now there's a sub-Q form that goes, there are 4 little needles that go just underneath the skin, right by the belly button. And, that's a good thing, because it's easier to get insurance to approve it because it's cheaper. And, some people will ask me, well, I need to be on it forever? It depends. I've been kind of studying it and looking at it for about 5 or 6 years. And, IgG products, supplements, have been around for a while, but they had the dairy component. So a lot of people would react. The good thing about this MegaIgA product is not only will it help with immunoglobulin levels, it blocks lipopolysaccharide, which is huge. And so, the term that's kind of used often is metabolic endotoxemia, where you mentioned if you have a dysbiosis, those endotoxins go from the gut through the portal vein to the liver. And so then you're overloading phase 1 and phase 2 in the liver. And not only that, they create inflammation throughout the body, and that inflammation is going to eventually damage insulin receptors, potentially leading to diabetes. So that's just one of many ways the microbiome is connected to metabolic health.
My gosh. So would you test a lot of these things with something like the GI map?
Mm-hmm. Yeah, so the GI map, the reason I like it so much is, not only does it look for pathogens and your commensal or good bacteria, but it gives you functional markers to go off of. So we can see if you're not absorbing fat very well. We can see if your pancreas is not creating enough enzymes. We can see if there is chronic inflammation in the GI lining. So we can check out beta glucuronidase levels, which, if you're estrogen dominant and we're, wondering why, that can give us some answers. It's going to tell us as well about, any sensitivity. For example, if you have H. pylori, which antibiotics that might be sensitive to. Again, we try not to use antibiotics, but to my knowledge, there's not a bacteriophage, at least available here, that will target H. pylori yet. And so the GI map will test that. You can check for SIBO or small intestinal bacterial overgrowth with a breath test, but 25% of the time it will give you a false negative result. And so a lot of times you go by symptoms. But this gets into the sympathetic parasympathetic balance through the autonomic nervous system. And, that's largely controlled by the vagus nerve, the wandering nerve. And so that vagus nerve, there's many theories out there. Some say that it gets infected, and that can lead to things like MS, Parkinson's, ALS. But if it's stimulated correctly, which it's activated by acetylcholine, it's filled with acetylcholine receptors, then it will turn on what's called the anti-inflammatory reflex. So, if you're taking a ton of anti-inflammatories, that might be okay, but you want to also work on autonomic nervous system balance, which, you're specialized in heart rate variability and how that works. And so the other theory is that mast cells can pinch or put mechanical pressure on the vagus nerve, rendering it ineffective.
You must be, are you familiar with the Bravo probiotics and the yogurt and that whole thing? And so if someone has, so I think one, we should probably explain that if there's a lot of people are not aware of what that is. And two, would that be a very bad idea if someone is already having a mast cell kind of issue?
So typically, I would say it's not a bad idea. You just need to put the things in place first to stabilize the mast cells, because long term, the Bravo, and I'll explain what that is, or the GC MAF, it's going to have, tremendous benefit long term. But if we just give that to someone and we don't stabilize or work on their mast cells first, then they'll probably have a strong reaction.
Okay. So for people who don't know, Bravo is a brand name of well, maybe you can do a better job of explaining what that is.
Yeah, so I've never actually used the Bravo probiotic, but GC MAF, which is a protein that was discovered a while ago, was popularized by Dr. Bradstreet. And so cancer cells and viruses produce a substance called nagalase. And nagalase basically disarms our entire immune system. And so what Bravo does and what GC Math did is basically lowering nagalase. And so that allows your immune system to come back online. And, those compounds require omega-9, oleic acid, and vitamin D to work as well. And so now there's some newer injectables that I won't mention for the FDA reasons, but they basically do the same thing. They're just a little more potent. And so, I know plenty of people who've used the Bravo suppository probiotics, and they've gotten good results. I've just never, personally used them or recommended them necessarily.
Regarding testing, we talked about GI map. As far as I understand, that is mostly or pretty much all looking at lower intestine, large intestine health and diversity and all of that kind of stuff. What do you like for looking at the small intestine health?
Yeah, so with that, like I said, there's the breath test, which you can do. And it can be helpful, in some cases to see, if you're hydrogen dominant or methane dominant or both are elevated. So for people that don't know, basically what you do is you go into an outpatient type center and they measure the gases coming out of your breath at baseline. Then they have you drink a carbohydrate-rich drink, wait about 45 minutes to an hour, and then measure again. And then they'll measure again a couple hours later. And so the bugs that cause SIBO or small intestinal bacterial overgrowth, they feed on sugar. And so that's why, if you have SIBO, low carbohydrate or low FODMAP type diet is necessary. Now, the only way SIBO can occur is if peristalsis is not working well enough. And so when we talk about, the bugs in the gut, we're referring to the large intestines. The small intestines should be relatively sterile. But when you have constipation or decreased peristalsis, that allows time for bugs from the large intestines to move up into the small intestines. And that's where your nutrient absorption occurs. So it's going to impact your nutrient absorption, but it also, it can produce a gas called hydrogen sulfide. Hydrogen sulfide inhibits your mitochondria and lowers body temperature, basically puts you in a state of hibernation. So, that when you talk about the small intestines, sometimes you can infer it from looking at, say, a GI map. If you see just massive fat malabsorption, you can kind of infer that SIBO is going on. If you have or pass a lot of gas that smells like rotten eggs, that's kind of a hallmark. For women, if they put on rings and it irritates their skin, I don't know what the mechanism is, but that seems to be correlated to SIBO. And again, with SIBO, the vagus nerve plays a role there because the vagus nerve controls peristalsis, right? Parasympathetic nervous system, that's your rest and digest, feed and breathe nervous system. And so you've got to have that balance. And that's where, if you don't work on balancing, heart rate variability and the autonomic nervous system, not only will you have inflammation that's out of control, you'll develop things like SIBO. And now, they've been using these for years, but they've gotten more popular, implantable vagus nerve stimulators. And they're curing things like various autoimmune disorders, MS, cancer. There's a few direct-to-consumer transdermal or transcutaneous vagus nerve stimulators. Unfortunately, I haven't heard of great results with them. I think they're working on others. Of course, there's a zillion vagus nerve exercises, but in my experience, when you have low vagal tone, well, first of all, no one usually has enough time to do all of the exercises, but the exercises alone won't improve vagus nerve activity. It usually requires, stimulation through using different devices that are becoming available, along with, meditation to balance, sympathetic, parasympathetic, and addressing any type of trauma, or what we call ACEs, adverse childhood events, that, are kind of driving our subconscious mind. And now if we look at them, they may not appear at that big of an issue. But if you're a child and, your world is, this big, then those things become very serious, and definitely affect your physiology. And we know that because if you looked at people with high scores on the ACEs, adverse childhood events, their risk for cardiovascular disease, autoimmune disease, is double or triple what it would normally be.
Wow. Well, I'm so glad you put a lot of emphasis on that, because psycho-emotional sort of somatic integration with the whole system and the healing process and therapeutics is absolutely essential. It's funny in a way how few people are willing to talk about emotions when it comes to the healing process. It's just I don't know if it's scary or if it's not being trained in it, but it's so important. So I'm really glad that you get into that. What's interesting, I think, and tell me if I'm wrong here, but in addition to gut motility, there is also the parasympathetic system that is controlling the ileocecal valve, which is, as far as I understand it, essentially that point where those bugs can creep up into the small intestine. So if you're in a chronic fight or flight response, that valve is essentially open or partially open, and that's where the leakage happens. Is that's correct?
Yeah. And so you broke up there for a minute. I think it's my connection, but when you look at the fight or flight response, one thing that's interesting, or one technique that's interesting, is called brain spotting. Are you familiar with it?
No.
And so it's kind of like, you've heard of EMDR. It's kind of like EMDR on steroids. I haven't had it done or seen it done yet. I'm supposed to connect with a local practitioner. But basically, it uses eye movements along with biofeedback and a baseline EEG. And supposedly, you can tell where the physical location of that memory or trauma is in the brain. And you do certain exercises you do the exercises until you are habituated to it and it no longer triggers a sympathetic response.
Wow. That is pretty neat.
Yeah. And, I don't want to change the subject too much and talk about psychedelics, but, some people who do ayahuasca ceremonies, if they do brain scans before and after, even just one ceremony, they'll notice a difference.
Yeah. It's funny that you bring that up, because just 2 interviews ago was with an MD who is now doing epigenetic research with MAPS and MDMA, and basically measuring this and identifying that PNEI system and its integration with that whole process, and also with ayahuasca and psilocybin to some extent as well. So yeah, it's super, super important. If we circle back to mast cells and talk a little bit about these inhibitors, right? What are again? You may have mentioned a couple, but what are some of these inhibitors that people can take?
Yeah, so some of the inhibitors from a natural perspective are quercetin. That's a common one. Dr. Theo Harrides, who's the world's leading expert and researcher on mast cells, has a line of supplements that include, there's I think 5 or 6 products, but they all, or most of them, include luteolin, which is Luteolin, and it's a substance that is pretty well absorbed in the gut, but it can cross the blood-brain barrier, and so it can help with histamine in the brain, because histamine that's produced systemically doesn't readily or very much at all cross the blood-brain barrier. It's the mast cells in the brain producing their own histamine and other inflammatory compounds. And so, we have, you could do things like a low histamine diet. Avoiding leftovers, wine, vinegar, cheeses or aged cheese, things like that. And that will help to a degree. Other things that will stimulate mast cell degranulation are stress, infections, we talked about mold, viruses, etc. But outside of quercetin and the Neuroprotect, which is the product that Dr. Theo Harrides uses for the brain, there are other compounds that will include PEA, which it can help with pain, but the way it helps with pain is by reducing some of the neurological or neuroinflammatory compounds. And that's included a lot of times with luteolin. There's different research, some saying that it does help, some saying no, but a lot of people tell me that it helped them greatly in terms of cognition, etc. Because a lot of people with, really bad anxiety, there's always multiple components, but histamine can be a major player in that. And then when you talk about, prescription mast cell stabilizers, there's things like cromolyn sodium, ketotifen, and some of these you can get, compounded so they have less ingredients or additives, which would, just aggravate the mast cells. Sometimes, depending on, someone's viral load and their mycotoxin load, they may need supplemental DAO enzymes. So again, that's diamine oxidase. And that's a big part of what I use. Even if someone doesn't have SNP or polymorphism in that area, just degrading and getting your histamine load down. We tend to front load these compounds, kind of like creatine when you're working out. You use a higher dose for a few weeks and then lower it. And so the DAO enzymes, you may need to take 2 with every meal for 3 to 4 weeks. And then you can go down to 1 with each meal. So that addressing it from the gut aspect is huge. And then, quercetin, vitamin C, especially liposomal vitamin C, can help a lot. Depending on, what all someone has going on and how well they process vitamin C, etc. And then the Neuroprotect, which, like I said, helps the brain. And there's another product called MegaIgA, MIRICA, and it has the PEA compound along with the luteolin. So it helps the brain as well in terms of brain fog, insomnia, etc. Because, if you have insomnia and you can't sleep, you're going to have all sorts of imbalances, including anxiety. Well, if the histamine is causing insomnia, then it's just going to cause even more anxiety. And so you have this vicious cycle. And so sometimes, it might take 2 supplements and 1 medication to get someone's histamine under control, or their mast cells, I should say, under control. But, all the while working on reducing those things that trigger mast cells. And a lot of it has to do, again, with, rewiring the nervous system and the whole polyvagal theory of how the vagus nerve and autonomic nervous system works, and, kind of retraining the brain, because it's not just, if there's a tiger sitting here, then everyone's going to perceive that as a stressor. But if I have a pin, someone, I might have had an incident 2 years ago, someone tried to stab me with it. So I perceive it as a stressor. And so for me, it's going to activate a sympathetic response. For you, it's going to be neutral. And so, that's where biofeedback and the whole PNEI system and working through that, because, we all have tapes playing in our head all day long. And most people, until they change the image of themselves in their third eye, their actions they'll continue self-sabotaging behaviors. And that just continues to contribute to sympathetic dominance. And when you're in that fight or flight system. And if you were born, prematurely, or your parents fought a lot, or even in utero, if your mom maybe resented being pregnant, or did not have a good relationship, with your father or partner, that can lead to sympathetic dominance.
My gosh. So I'm just, you probably know about this already, but what's so interesting is I was using a neurofeedback system for a while called Signet, produced by, are you familiar with Signet?
I think I've heard of it, but I've never used it.
Signet is, it's really unique in its approach to neurofeedback because it specifically addresses the glia of the brain. And it is found favor mostly with the autism spectrum disorders in this community as being very, very effective. And it's so interesting that you're talking about mast cells as the precursor to essentially turning all that system on and creating this neuroinflammation. And yeah, very, very effective. I mean, it's so effective that if you don't, if you're, I don't know, if you're in the normal range of brain health, we'll call it, whatever that is now,
right.
That if you do this for about 15 minutes, you'll fall asleep. I mean, I've had people that just cannot keep their eyes open anymore. You feel like your eyelids are so heavy that you cannot keep them open. So that's pretty fascinating.
Yeah, absolutely.
How big of a deal do you think viruses are now in generalized chronic disease?
Oh, huge. And even traditional medicine, I remember about 6 months ago, I was watching TV, which I rarely do, but I saw a little blurb go across the bottom saying, I don't know if it was the American Medical Association, but basically that traditional medicine is now realizing that there's a significant role viruses play in Alzheimer's. And so, again, that works through multiple mechanisms. When you have or turn on those microglia, that will cause tryptophan to get converted to something called quinolinic acid, which is neurotoxic and will also increase glutamate. And so in the short term, it makes you kind of cranky, maybe short-term memory loss, trouble learning, but long-term, it leads to neurodegeneration. And so people need to forget about the flu and being sick for a week on the couch and worry about these viruses that, we don't typically associate viruses with joint pain or brain fog. But, cancer has been linked to different types of viruses. MS, Parkinson's, all have been linked to either a high pathogen load and or elevated microglial activation. And something else on top of, certain viruses, the ones that tend to impact people with CFS/ME and autism tend to fall into that category of neurotropic viruses, where they like to live in the nervous system tissue. And that creates havoc in and of itself, independent of everything else I've mentioned, because, your brain is constantly evaluating, whether something's dangerous or not dangerous, whether to pay attention to something or not, And so, if the brain is thrown off because the sensory systems are not telling the brain the same thing, it's like me and two other people yelling at you in 3 different languages. And so you'll have poor balance. You can have vertigo, tinnitus, depth perception issues, mood issues. I remember I took a physiological psychology class, and one of the first days the professor said, hearing equals behavior. And, I didn't really understand at the time what he meant by that. And one of the MDs I trained with is an ENT, and he just said, these viruses, he found a way to do certain hearing tests and look for certain patterns, and he could pick out, those who had a high viral load and who didn't. Typically are bad at sports because of sensory integration. And, the eye, for example, at Nike headquarters, they have a machine that helps you improve tracking, convergence, basically a behavioral optometry machine. So it's not just about, 20/20 vision. It's how well can your eyes track and send that information to the brain. And then you have your proprioceptors, on your joints, and then your ear. And so all of those things can be impacted by viruses as well. And then when you look at behavioral issues and addiction, most people that I've worked with who've had addiction issues, they're typically not trying to get high, they're trying to feel normal. And so, if you have a high amount of mold, which drops or decreases your blood flow to the frontal lobe, you have a high viral load causing your brain to be on fire, then you're going to either resort to overeating or recreational drugs or, something else to try and feel somewhat normal. And, you can go to all the rehab clinics in the world, and those places are just a revolving door because you can't out therapy a physiological imbalance. And I think therapy is very important, but, at the same time, they have to recognize that the physiology is important.
Yeah, it's a multi-dimensional path to healing. If you only go down one route, it's going to be very, very difficult. Okay. I'm going to collect my thoughts right now, Dr.
Sure. Sure.
From your vantage, anything, I know what I was going to ask you, but I'll put that on pause. If from your vantage, anything we haven't covered that you want to?
I'll name off some of the markers, the most common markers used to test for mast cell activity. So you can test, regular blood histamine, but again, a lot of times that's not high because it gets degraded quickly. If it is high, for example, I had a patient the other day who hers was high and she was already taking an antihistamine. So that means it would be really high if she weren't. Then a 24-hour urine is in methylhistamine. It gives you a little, better picture of histamine. Then prostaglandin D2 and prostaglandin F2 alpha. Those can all be done through LabCorp. And then the marker, I'm pretty sure it can be done through LabCorp, MIAA, which is a metabolite of histamine. And so one thing to recognize is what we've been discussing during this interview is really mast cell activation syndrome. That's different than mastocytosis, which is where you have collections of mast cells in different parts of the body, especially around cancerous cells. That's a whole different issue and is addressed differently. But the mast cell activation is something, that if we just walk down the street, I would say probably at least 60 to 70% of people are impacted one way or the other, directly or indirectly, by mast cell overactivation.
Okay. My question was around detox, and this sort of related to our earlier conversation. I meant to get in there. Every once in a while, I come across someone who cannot tolerate glutathione. Mm-hmm. And I have no idea why, but I'm wondering if you might.
Yeah, so glutathione, people usually react in one of three ways to glutathione, in my experience. They either feel great and stay feeling great. They start out feeling good and then crash. And my reference point is, certainly I have or recommended people liposomal glutathione, but in the clinic, when we've pushed glutathione on patients, some feel amazing and stay that way. Some say they felt good and then, 2 hours later they felt terrible. Some will feel just terrible in general. Typically those people, it could be a number of things, but if, for example, you're not having a bowel movement every day or 2 bowel movements every day and you push glutathione, you're essentially just retoxifying things, and, redistributing toxins. Sometimes it has to do with sulfur intolerance, and that can be due to that CBS polymorphism upregulation. Sometimes it can be just due to the person's overall viral load or immune system activity, because there's Th1, T helper 1 cells, Th2, and then there's Th3 and Th17. But to keep it simple, glutathione, when you have enough of it, it allows a dynamic immune system to switch from Th1 to Th2. When you don't have glutathione or you get depleted of it, you get stuck in a Th2 system. And that Th2 system, like I said, leads to the 3 A's: allergies, asthma, and autoimmune disease. Then when you add glutathione, you're switching it back to Th1, and that allows you to address intracellular infections. And when you switch the immune landscape really quick like that, that can be part of why they feel poorly.
That's
it could be, cytokines from a quote unquote die-off reaction, even though viruses are never technically living. But glutathione is a very powerful antiviral, natural antiviral. Most people don't know that. And so when you take someone who's really glutathione deficient and you switch them, the immune cells change, become more active, and depending on your heavy metal load, environmental toxin load, it could overwhelm the liver as well. And so a lot of times prepping people with drainage remedies, which are a little gentler, that can help, kind of prepare the body. And then what I've found is using supplements that support both phase 1 and phase 2, what we call dual phase optimizers. Because if you take phase 1 and you speed it up and phase 2 is not equally sped up, you have all these harmful free radicals and compounds sitting around causing harm and damage.
I'm going to have to listen to this interview a couple of times just to absorb everything that you're saying. Thank you so much.
A lot of information. Yeah, absolutely. Thanks for having me.
Tell listeners, you're doing consults, right?
Yeah, I'm doing consults.
So how do they find you and what are you up to?
Yeah, so my website, excuse the mess, it's being redone, but it's healyourbody.org. My email is DRTIM, so Dr. Tim, 072981 at gmail.com. People can also Google my name and it'll bring up a ton of content, from podcasts to summits and webinars and articles, from my own website, but also various other websites, that provide a lot of good information that even a lot of functionally trained MDs don't know.
Well, thanks again and good luck with everything.
Yeah, thank you for having me. I appreciate it.